Now to a Call 12 for Action alert about the cost of health care. Medical bills in Arizona have jumped 25% in the last 6 years, with more of the cost being shouldered by consumers. But what happens when the cost is well above the average?
A man in the Valley recently received a bill that he thought was just outrageous, and he reached out to Call 12 for Action for help. Team 12's Matt Morrow explains.
Great. That's how Marv Wessel's back feels today. But roll back in time a year and a half, and Marv was in the worst pain of his life.
Tears. Yeah, when it comes to pain, that's the worst pain I've ever experienced.
The pain was caused by a pinched nerve, and after spending 3 days in the hospital, Marv was able to go home and get back to work. Then, about a year later, Marv received this bill from the hospital for $35,247.
Boom, $36,000. You're like, excuse me? That's not going to work.
The reason is because Marv's medical bills were drastically inflated. Our Call 12 for Action investigation discovered he was charged nearly 10 times more than the going rate for some procedures. For instance, the hospital billed Marv $11,180 for an MRI, but the Healthcare Blue Book, which is designed to inform patients about average prices for healthcare, reports the fair price for the same MRI is just $1,156. So Marv called the hospital over and over, trying to get a hold of someone who could negotiate the bill. He says he was told to pay it all or set up a payment plan, or else it would go to collections.
How frustrating was that, dealing with the hospital and trying to talk to someone to potentially negotiate these bills?
That person's not there. That person's not there. You can't find them. They're unobtainable.
Marv certainly isn't the only patient who's struggling to negotiate health care costs and simply afford them. A Kaiser Family Foundation New York Times survey found 67% of people who attempt to negotiate their medical bills are unsuccessful. All as health care now costs Americans $3.2 trillion every year.
It's the majority of the public that are actually really feeling the pinch and the confusion right now.
Swapna Reddy is an attorney and healthcare policy expert at Arizona State University who studies healthcare law and disparities.
Why would there be a discrepancy between the hospital Blue Book and the cost that the hospital is charging? And not a small discrepancy, but a big one.
It's hard to say. I think that it's more of an issue of errors than it is really a hospital trying to be nefarious and trying to get as much money as possible.
In Marv Wessel's case, there was no error, and although he could not negotiate the price of his medical bills, Call 12 for Action did. Marv ended up paying just $10,000, less than a third of the original bill. He also signed a non-disclosure and agreed not to name the hospital.
It's terrible, just terrible. I mean, you're at their mercy. You know, you need care, you're in pain, you need something to be done. When you find out what it costs you, you know, that's when the big surprise shows up.
That's a surprise that's just like Marv's back pain, something he hopes to never have again. Matt Morrow, 12 News.